For me, dying is a very natural process of living. It is a moment of completion of life that's here on earth. Somebody once told me that dying is by yourself. You can have people surrounding you, but you make their own journey. And for him, it is like flying up to the sky, into the space. And I think there's nobody around you following you, and it's quite frightening. There's no turning back. You just float up. And the other one said that she's just being invited into that forest. You know, many trees, it's all green, but a safe forest that she can find the pathway and in search of that light that is being hidden among the trees, among the branches. And this person happened to be someone that loves plants and all this, and she see her death as that, going into something that she loved. Our role is accompanying them to the journey and to be with them in their pain, in their joy, and even in their disappointment, and to really witness their death. I always believe it is an invitation.
One day visiting these people who will very soon die, it was for me enough to understand that each family will need palliative care. Each family, if not today, but very soon or after several years, will need palliative care. Each doctors have to know even some part of palliative care to reduce suffering of these people. Not just pain, many symptoms of suffering, many psychological issues, many social issues. And when I was student in St. Petersburg Medical Academy, Pediatrics Medical Institute, my father died and my sister didn't tell me, and I can't have chance to tell goodbye to my father. I can't kiss my father last time. I can't be kissed by my father last time. And it was still in my heart. Still I am grieving. And I think it was one of other motivation to do hard decision to establish palliative care in Mongolia.
In Mongolia, about 80% of cancers are diagnosed fairly late, in almost third stage, terminal stage. And there is nothing which can be done except to relieve the pain and suffering, not only of patients, but of the families. So palliative care is very, very important. And palliative care is really taking them back to basics, which is really the essence of primary health care. And a lot can be done.
Passes. Do you think? We need to tell with sorriness. Not just because we have to tell it. You are human too. And you always... Palliative care is a soul of medicine. Palliative care must be included in all kind of medical specialty. And teaching palliative care, our students learned attitude, communication, consultation skills. They learned so much about how to be good doctor with not just knowledge and skills, with good attitude, with empathy, with humanity. It's very important. Palliative medicine is psychologically is very difficult kind of medicine, and it's very hard for doctors and for me too to every day listen their suffering. It's very hard, but still I do it because since 2000 I feel not just responsibility to establish it. I feel myself as a mother. You know, mother never will burn out from your children. Most women worked with me for developing palliative care, and women understand it much better because it's maternal instinct. They understand that each family will need it. Because of this, they come to palliative care.
你是微左哈，微左，婷莹，婷佑，你好。现在还痛不痛？痛的话，痛不痛？不痛啊，现在不痛了。你喜欢住这里吗？喜欢住医院还是喜欢回家？不喜欢就要摇手。喜欢吗？不喜欢。金窝银窝不如自己家的窝嘛，对不对？死亡在华人的文化里面是一个禁忌文化，那所以病人如果快去世，病人不能告诉他，家属不能讲，那我们想要问他的意见，他要接受什么样的照顾等等，他都没有自主权，因为没有办法跟他公开的讨论，这个是一个文化的一个禁忌，是一个挑战，一个困难。我是1987年就到英国去，跟 Hospice Palliative Care 的 founder， Dr. Cicely Saunders， 我是亲自受教于他的门下。那个时候我看到一个病人可以这么平安、这么安详的去世，然后他的家属当然伤心了，可是他们没有遗憾，没有悔恨。我那个时候反观台湾，我们每一个病人去世嘛，都是插了一身的管子，最后还来一套 CPR， 把肋骨压断，流了血，流了眼泪，这样断气，然后家属是呼天喊地。我就那时候有一个很深的体会，说，我们台湾的同胞啊，人命不值钱呐，为什么我们的人会死得这么凄惨？没有善终哈，叫歹终哈。在美国念完书回来，以前我就摆好一个蓝图，因为台湾谁都不知道安宁疗护是什么东西，那也不知道要怎么做，所以我从开始就有4路并进：第一路服务，第2路教育，第3路制度政策，第4路就是本土化的研究。看起来他的情况是很不稳定。我们传统的医学教育里面只教生老病，没有教死，因为死亡是医学的失败，是医疗的失败，所以碰到病人，假设是病不能治，命不能救，他们就要用现代的18般的科学武器，然后把病人整得不成人形。他们不知道什么叫做死亡的品质，什么叫做善终。我们非常感谢台湾有很多媒体，做电子媒体，还有平面媒体、报章杂志，他们开始宣导这样子的一个理念的时候，那个病人呢，他自己有这个概念了，他要善终。
来，继续上呢，这一点。 那个你看呀，镜头没有看镜头就不帅了。
好久没见面了，
好久没见面。飞到另外一个屋顶。
爸比什么时候可以出院啊？
来，我告诉你，爸比出不了院了，爸比快要死掉了。你知道死掉是什么吗？
知道。
不知道，小阿姨不是跟你讲过吗？她会到天上去做小天使。小阿姨跟你讲过，妈妈也跟你讲过。爸比现在病得很重，每个人都会生病，小猫小狗也会生病，花也会生病，树也会生病。
这么都会生病。
对，是真的人、真的花、真的草、真的鱼、真的虫就会生病。所以呢，爸爸现在就是运气不好，得了一个大病。爸爸今天可能就会死掉，所以可是他听得见，他没有办法反应，所以你等一下去跟爸比讲话，爸比可能没有办法回应你，但是他永远会爱你，永远爱妈妈。这你要相信，你要肯定，你要记得，你会记得对不对？爸比永远爱你。那去跟爸比说，你很爱他，妈妈也都听得见，永远跟你一起支持陪伴
In working with HIV population, I think that they need a lot of things like opportunistic infection treatment, ARV treatment, and palliative care. So palliative care, you provide them pain management and social, psychological, and spiritual support, and not only for the patient but also for the family member. And nothing is more important than the other, and it should be fair and equal.
Vai trò của việc chăm sóc giảm nhẹ tại trung tâm là làm cho trước tiên là nhằm vào đối tượng là người bệnh, vì họ có tư tưởng bi quan, chán nản, và đặc biệt là sáng kiến của bác sĩ Thủy lại hướng tới cái việc là chăm sóc giảm nhẹ cho chính những y bác sĩ, những cán bộ làm công tác chăm sóc cho những người nhiễm HIV.
If the person, people, they have the same situation, they easily to share. And for me, my family member passed away, so I easily to share with other who also lost their loved ones. And palliative care can promote the meaning of life, the value of life. And as I am a teacher, so it brings me a lot of benefits in terms of knowledge, attitude, skill. I think that I live better. I have a good view to sympathize, to share with others.
If you think that death is a routine in a hospice, then we are really, really stressed. Death is not a routine. Death is really the part of not thinking about death, but thinking about living. And death itself is part of that journey.
Hello, Gloria. Good morning. Come and sit with me.
Dulu tempatnya ada tidur tak? Ada tidur tak?
Ada.
When I entered nursing, the family had just lost someone in the ward, and I was really crying with them. And one of the one in charge came to me and said, "You are a nurse, you should not be crying, go and wash your face." So it kind of threw me off, and I said, if I really want nursing, I want a nursing that I can really empathize, and I wanted palliative care just because of that I can really listen with the heart, listen with my mind, with my emotions, and yet being supportive to the family. One of the main things that I ask my staff to say, never count the number of people that you have ushered to eternity, in a sense that you cannot say, I've seen so many. How many? Maybe 30, maybe 40. There's no number to it. Today, if I witness someone, it's my first one. Palliative care is about asking the person how you want to live. Is there anything that we can do for you? And it may not be big things, like traveling around the world. It may be very simple thing. In palliative care, you are invited to be in their circles, not we pushing ourselves in. I think the invitation is very, very important. And their invitation is not doctors, it's not nurses. It's someone that they have felt the care. And someone may be ordinary that is seeing to their tables, their beds, making their bed. And that is the someone that they need, not someone that can do, someone that they can talk to.
When I see the children in pain and later on see that they're happy using my facility, and the parents feel gratitude and tell me that I'm doing something for them, I get the strength from them, and I think that I should do more and keep the children happy.
This is a free hospital, no cost is needed here, and so our priority is curative, to treat the cancer patients like leukemia patients and lymphoma patients. We cannot afford to have a palliative treatment unit over here, but the hope is that there are palliative management being taken place in private setups.
When I was looking for centers that are providing palliative care, I got to know about Ashik Foundation. And what they've done is amazing. I think they have the most comprehensive palliative care service in the country, the first of its kind. I used to think how wonderful, they're not physicians, but they're so motivated and they're always including everyone. They're very inclusive.
After losing my son, Ashik, in 1993, I was very much depressed and devastated. My husband, he wanted to bring me out from the devastation situation, and then we thought to establish a foundation and help the children, those who are suffering from cancer, and after that we started this foundation. Ashik was treated in London. We couldn't get him diagnosed in here, and we had no idea that children could suffer from cancer. I started to work from 1994, and we made a shelter home where we could reach some of the families, and later on they came and told us the last days of the children and how their sufferings was. And I thought my son had a comfortable death in UK, and I thought that it would be better if we do the same for the children in here, because here the parents do not know anything about cancer and the aftermath of the disease.
My name is Pavel. I am reading class 1. I am 9 years old. Last year my birthday, I have pain This year, my birthday wish, I will be okay.